You're here with me today because you're concerned that your dog may have an ear infection. There are multiple types, so let's talk about it. Hi, I'm Dr. Wolf, veterinarian of 24 years. This is my assistant, Pepper, and we're going to talk to you today about ear infections. If your dog is having difficulties with their ears, you're going to see things like rubbing on surfaces such as the couch, the floor, the carpeting, even on your shins. I call that carpet surfing and shin surfing. They may flap their heads and they may be scratching at their ears a lot and possibly even groaning because it's so itchy in there. If it is time to take your dog to the veterinarian, you will be seeing things like redness in the ear, possibly even some bleeding if they're scratching at it, and there's definitely going to be a gross odor that some people describe as sort of musty and definitely yeasty. The causes of ear infections are usually allergic in nature, meaning they might have an allergen to something in the environment, or it might even be a food allergy. So right now, we just want to get rid of that ear infection if it's there. So I'm living with a chronic condition, cerebral palsy. So as I'm moving around my dog, you may see that my left hand doesn't really work exactly the same as my right. Come here, Pepper, come. Sit for me. Sit. Good job. Can I look in your ear, sweetheart? I know you don't like it, and I will be gentle. It's okay, and I'll get you a greenie when we're done. Ready? Okay. Yeah, so Pepper, your ears are full of fur like an old man. That is not at all what we want. And you've been scratching at your ears. Ooh, and they do smell gross. And I bet you if I stuck my finger in there, which the owner can do, yeah, there's a little bit of discharge on there, and it's a little brown. Smells a little bit yeasty, and so she's got a mild yeast infection. All right, Pepper, you have been itching your ears just like we were talking about, also scratching in there. And if I fold over this ear flap, rather than it just being naked and pink, is incredibly full of fur. It's kind of like my grandpa. So we don't usually recommend plucking dogs' ears a whole lot. It's disruptive and it hurts. But when there's a little ear infection going on, sometimes pulling out the excess fur will really help the situation. Yeah, it smells funny. It's because you have yeast in there. So if your dog's ear looks like this and it's very furry, and if it has a lot of redness in it, and it's got dark debris or even green debris, it's time to take the dog to the vet. And the reason is the dog's ear canal is L-shaped and the eardrum is all the way down here. So you're only seeing what's up here, which is the fuzz and some of the gooth. So a lot of stuff is accumulating down in there. So what to expect from your veterinarian when you do take your dog in? Because I basically want you to be sure that you're getting the services your dog deserves and you're not receiving services that you don't necessarily want or aren't absolutely necessary. So for a simple ear infection where this dog is running her face along the couch or she is flapping her head or scratching at her ears, I'm going to try something at home first. And it's yeast in there, most likely based on the odor. So I'm going to put a little bit of a drying agent inside the ear, and then I'm going to pluck some of that fur out and then wait about 24 or 48 hours and see how that ear is doing. If that ear, bless you. If that ear is still red after the 24 hours, your dog's really shaking their head or it's moist and wet in there, please take them to the doctor. Upon examination, they're going to fold the ear back. They're going to take a look in the ear. If it's really fuzzy like this, they won't be able to see inside the ear canal, so they probably won't put an otoscope in. Plus, it'll be very, very painful, and that is that device where we can see the eardrum. They'll also take a sample of the ear, put it on a microscope to try to identify what's growing inside that ear canal. Then the ears will be cleaned and you will be sent home with medication, or they'll pack the ears with medication at the clinic. You may or may not also be given some oral medications depending on what the cause of that ear infection is, which can be anything from allergies to moisture after a bath, to getting something stuck inside the ear. So after you've got all your medications and you're home, you should follow through with at least usually a 7 to 10 day course of medications. Don't be afraid to ask questions. Don't be afraid to ask how much stuff costs. And you don't necessarily need to jump straight to a very expensive culture and sensitivity of the ear. We wait for chronicity or it recurring constantly before we go an extra step like that. Thanks so much for watching this video. If you have any questions or concerns regarding any of your furry animals or even birds, please let me know in the comment section. Also, if you can think of a topic you'd like to learn more about, let me know that as well, and I'll think about making a video just for you.